Today we have a very unfortunate case in the OR. We have a patient, as you can see, they were out in the woods riding a dirt bike, hit a tree and became impaled by a stick or limb. Now I don't know how far into the patient this goes, but as you can see, it is in there fairly well. As always, the patient has already been informed that this could be a very extensive surgery with a very extensive recovery time. The patient has been prepped and has already been given a general anesthesia. So there is really no way to go about this other than a vertical incision all the way through the center of the patient. Now this is tricky, and it takes a lot of patience, and it damages a lot of tissue, and there is no way around that. So I am going to try to be as careful as I can. However, there is no real way to do this other than the hard way. So we're going to make that vertical incision there. And we are getting some bleeding. We are getting a little bit of superficial skin damage right here. Again, really no way to prevent that. Let's see here. Go right here. I'm going to try to be so careful. There we go. That's not too bad. Now this is an older patient. We are getting a lot of skin damage here, and I'm going to try to keep that to a minimum. However, a skin graft might be needed after this surgery, so let's see what we can see here. Slowly. Oh my goodness. Oh gosh. This is really not the best scenario. You can see here, let me get this. You can see here the stick, where the stick entered, and you can see it kind of frayed off and actually went right through the stomach here. And there is a lot of swelling and infection. All of this here is infection, so I mean, that's to be expected for such a large foreign object entering the body. So the best we can do is remove the stick, try to remove as much of the infection as possible, and hope for the best. I don't mean to sound pessimistic, but this is not the best situation. So the first thing we're going to do is cut some tissue right there around the skin. And I'm going to try very carefully, because what we don't want to do, we don't want to lose a lot of tissue. However, we don't want the little shards of this stick gosh. Okay, there you can see that infection ball there. Very, 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 very bad stuff. Okay. Very, very bad situation for this patient. Okay. Now, there is still some damaged tissue here that we have to get out. Okay. Now I have two options here. The stick and its remnants have been removed. Now you can see the darkened tissue, which is infection. I can either treat that with an antiseptic, put the patient back together and hope for the best, or I can try to cut out all of that tissue. Either option has its own problems. For instance, if I try to remove all that tissue, the patient is not going to be left with a lot of tissue because the infection is so deep. If I just treat it with an antiseptic, we can push IV antibiotics after the patient is done with surgery. And I think that's the best option. I'm going to remove the worst of the tissue, but I'm not going to try to get all of this out because there is a lot. And actually, I don't even need a blade for that, I don't think. I think I can just... yeah. Oh, that is a lot of infection. But it's actually coming out a lot easier than I suspected, which is a great thing. I'm glad we decided to at least try to get it out of there. Okay. Well, there is some stick left in there too. Wow. So it basically went all the way through the patient. Okay. All right, let me try to get the infection on the other side out of here. Oh, yeah, there's a lot. Yeah. This will definitely help our patient feel better very, very quickly. A lot sooner than if we wouldn't have got this out of here. So this is great. Okay. That's about all the tissue I want to take. It does look like there is a little bit of the stick left here. We're going to clean that out just a touch. Yeah. See those fibers that have kind of pushed their way there? Yeah. A few more right there. Okay. All right. Okay. This surgery is about as successful as it can be at this moment. We are going to close the patient back up I will have my nurse suture the patient back together. And then we are going to push a very bolus dose of IV antibiotic to get this patient back on the path to recovery. But as you can see, that stick went all impaled the patient completely. So glad that they got to us as quick as they did. You can tell how quickly this infection started taking over the body. And it could have been absolutely fatal if left untreated for too long. So I will get this mess cleaned up and have my tools cleaned and autoclaved. I would like to genuinely tell you thank you for joining me in the OR today. I really enjoy you being here. It would mean the world to me if you like what I do, if you could hit that like button for me, and subscribe to the channel and turn on notifications so you can always be notified when the OR is accepting new patients. Thank you so much for joining me, and have a happy, healthy day.